Good morning, and thank you very much for coming to talk about our Mental Health Commission package of bills that we're introducing in the Senate this morning. And I'm Senator Liz Brater, and I want to thank the senators that are joining me this morning: Senator Gilda Jacobs, Senator Irma Clark-Coleman, and Senator Cherry. And also we have John representing Senator Gleason's office, and who couldn't be here today, and Mark Reinstein from the Mental Health Association. So thank you all for joining us, and we're very proud to be standing up here to introduce this comprehensive package of bills, which is a very important follow-up of the work of the Mental Health Commission, which Senator Jacobs served on. And that commission was formed several years ago by Governor Granholm to examine the mental health system in Michigan and find out how it's working. At the time, Governor Granholm declared the system is broken, and that is still the case. The system is still broken, and we have an urgent need to implement these recommendations and to make sure that people with mental illness have access to mental health care here in Michigan. It's the responsible and the humane thing to do, and it's also our duty under the Constitution of the state of Michigan to implement these guidelines to make sure that people have access to the system. So what this package of bills is doing is three things. It's clarifying, streamlining, and safeguarding. It's clarifying the definition of mental health, access to mental health care under the code, so that there is currently some confusion sometimes about who has the right to access. So we are trying to make clear to everyone in the system that not only danger to self or others is a criterion for access, but also the lack of understanding of the need for care, which is a not uncommon symptom of mental illness. We're streamlining by reducing the number of community mental health service providers, and Senator Gilda has a bill on that, and she'll be talking about that in more detail. We're safeguarding access by providing an appeals process and giving families access to medical records in the unfortunate occasion of a death, and increasing accountability of the system, and Mark Reinstein will be talking in more detail about those. And why are we talking about these bills right now in the middle of budget negotiations? It's very crucial that there is sufficient money in the system to provide the cost of these services. When we open up the system and guarantee these rights to care, we need to make sure that the service providers have adequate funding. And right now, in the Senate adopted version of the bill, there's $56 million less in general fund dollars going for the non-Medicaid population, and that is the population that is falling through the cracks. People who, under the mental health code, have a right to services, but we are not providing the funding that is necessary. So we want to do the right thing for the most vulnerable people in our state, and we hope that our colleagues will join us in supporting these bills, and we thank you very much. And here's Senator Gilda Jacobs.
Thank you. And I want to thank Senator Brater for continuing to be a passionate advocate. Ever since I've known Senator Brater, she has been in the forefront of talking about these issues. I think it's important to note that even though we are struggling with a budget and having problems figuring out how we're going to balance our needs and priorities, we can never, and none of us have lost sight of the fact that people that are served through the mental health system are starting to fall through the cracks, and in the long run end up costing the taxpayers in Michigan even more money. And from a humane, compassionate view, we know what we need to do in terms of the right thing, and clearly from being fiscal agents, we know that we have to do this as well, because we don't want there to be even more strain on an already strained budget. Now, I did sit on the Mental Health Commission there were 4 legislators, Andy Meisner and Fran Amos over from the House, Bev Hammerstrom and myself from the Senate. I'm like the surviving non-terminated member of that commission. And it would be very easy to take the recommendations from the commission and put them inside a file cabinet and not look at them again. And the purpose of this package of bills is to take those out of the filing cabinet to say, look, we recognize that these are our priorities and we don't want them to get lost in the shuffle, and that's why we're here today to talk about these things. Briefly, my bill is just a streamlining bill that we're trying to reduce the amount of administration that there is. Right now, there are 46 CMHs all over the state of Michigan, and my recommendation is to bring those down to 18. Actually, the actual commission's recommendation was to bring them down to between 18 and 39. And it's a time when we need to do more with less. I think this is one step in the right direction.
I'm pleased to be here today. The Mental Health Association is the state's oldest advocacy organization for persons experiencing mental illnesses. I had the pleasure of serving with Senator Jacobs on the Mental Health Commission, and that commission was the broadest based, most comprehensive citizen review of mental health policy in Michigan in a quarter century. And the commission in October of 2004 gave the governor 71 recommendations for improving services in Michigan. And I think some of the critical areas, and I'm just using slightly different terminology than Senator Brater in one or two cases, but it means the same thing. Some of the critical areas to me are better protecting the rights of applicants and recipients in the publicly funded mental health system, improving access to services. But also, we have to do some things. There are far too many people with severe disorders in our state who, for one reason or another, aren't being connected to the public safety net, to public services, which are there to be the safety net for people who have nowhere else to turn.
My bill, which, by the way, is not ready yet, but it will be very shortly, but my bill allows the closest surviving member of a deceased recipient the ability to access that recipient's mental health records unless the recipient acted to prohibit this. I mean, sounds real simple, but it's a problem that many people are having. So I think all of these bills in this package contain ways to simplify services. And I have experienced some personal situations within my district of people who have come up to me who've had great difficulty in accessing those services. So I'm hopeful that with this package of bills, it will now be much more simple to get the necessary services. Thank you very much.
Yeah, I just really wanted to just say that I think the whole package of bills should be looked at as a whole package, and that it's important for us to finally, I think, we've waited long enough. It's time now to do make the changes that we need to make in order to assure that people are getting the care that they need. And Senator Clark-Coleman talked about times of people who haven't been able to get that in her district. I think we can all point to that within our district. It's always been an issue for me to try to improve services, and it's a complicated system. It's hard to impact it. So these bills are a good way to get that going. The other side, the side that I'm probably more involved with, is really the side of funding, and that's the other side that we have to make sure occurs. As Senator Brater talked earlier, the Senate budget cut out $56 million, I think, in non-Medicaid funding, and that really impacts the flexibility of the system to be able to serve people who may not be eligible for Medicaid but really need the access into the system. And so I'm hopeful that through this budget negotiation, we're also working to restore those dollars. Thank you.